Welcome back. On this Health and Wellness Thursday, we are going to turn our attention to lung cancer. There have been some recent exciting developments, actually, and I spoke with a patient advocate, also a survivor of lung cancer, as well as a physician recently, all about what you need to know and also the importance of early detection. Let's take a look.
A new report shows major progress in outcomes and early diagnosis for lung cancer. According to the report from the American Cancer Society, an exciting breakthrough in this type of cancer. There have also been new developments in the treatment of early-stage non-small cell lung cancer, the most common form of the disease recently. The FDA has approved the first and only immunotherapy to help prevent lung cancer from returning in certain patients following surgery and chemotherapy. Joining us to talk about these latest developments in lung cancer are Dr. David Carbone and patient advocate and survivor Bonnie Addario. Thank you so much, both of you, for being here.
Thank you for having us.
Thank you for having us.
Dr. Carbone, let's start with you. Can you tell us about one of the major developments surrounding lung cancer outlined in this year's American Cancer Society Annual Facts and Figures Report?
Sure, I'd be happy to, Christine. So lung cancer is the #1 cause of cancer death in the U.S. and around the world for both men and women. And it's historically been a really difficult disease. But the American Cancer Society report has recently published that the survival from this disease has been doubled in recent years through multiple new therapies that have become available, but also through increased detection of the disease in early stages when it's most treatable, and the development of new treatments when the disease is caught early.
And Dr. Carbone, can you define early stage lung cancer and why it is important to treat the disease at an early stage?
Sure. For the purposes of this discussion, really early stage means when the cancer is localized in the chest so that it is possible to surgically remove the entire tumor. And in that setting, the patients have the highest probability of cure for their tumors. But unfortunately, historically, even when the cancers are found in early stage and are completely surgically resected, about half of these patients still have their cancers come back and die from lung cancer, which is what makes the new treatments even more exciting.
Bonnie, in your experience as a lung cancer advocate, how important is it for patients to be diagnosed at an early stage?
It's very, very important. It's the key to the whole process. You can't get the therapy unless you've been diagnosed and it's been confirmed that you actually have lung cancer. And we need to work on both of these things in a big way to get more people screened and to get more people surviving this disease.
Dr. Carbone, can you talk about the current treatment landscape right now for patients with early stage non-small cell lung cancer and any new advances?
Sure, happy to, Christine. So, as I said, the best treatment and the most likely to cure is still surgery for these patients, but that the cancer often still comes back. And for decades, about the best we could do to improve on those odds is to give a few cycles of chemotherapy after surgery, which improves outcomes by only a few percent. But recently, we've developed new types of therapy, and specifically immunotherapy in this case, and that harnesses your own body's immune system, that enables an improvement in outcomes after chemotherapy and surgery, and it decreases the chance of the cancer coming back. So today we're partnering with Genentech to raise awareness of patients in this diagnosed with early stage lung cancer about this new treatment, but also to let them know that these treatments are cancer treatments, all of which have side effects, and these treatments are not appropriate for every patient after surgery. So it's important to talk to your doctor about whether you might benefit as a patient from these treatments.
And Bonnie, what does progress in early stage lung cancer treatment mean to you, and what do you want others to know about it?
Well, one thing it means to me is that people no longer need to be afraid or concerned about getting a CT scan to see if they have lung cancer, because it used to be that there was very little to offer them at this place. So now they have an opportunity to live. And advocacy, just so you know, is a bridge between patients and the physicians, and we help them unwrap the information that's flowing to them to get them the right information so they get the right drug at the right time.
And Dr. Carbone, what else do we need to know right now about this topic?
So as we've been talking about, early detection is key, and if patients are smokers, then they should be aware of lung cancer, the availability of lung cancer screening, which improves lung cancer survival by detecting patients early, and the availability of very patient-friendly resources for understanding what's going on, and one of which is the GO2Foundation.org website with the number 2 in the name, GO2 Foundation, but also other patient advocacy organizations like Longevity or Lung Cancer Foundation of America.
Well, thank you so much, Bonnie and Dr. Carbone, for joining us today. Really appreciate both of you for telling us more about lung cancer. Bonnie, thanks for sharing your experience and passion about it.
Oh, you're welcome.
Thank you, Christine.
I'm thrilled to be here.